Hey, everybody.
Hi.
So tonight we are welcoming you to the perfect storm. Here at New Journey Chiropractic, one of our favorite things to do is to educate and to teach our community about chiropractic and to teach people better ways to manage their health. So if you don't know who we are, I am Dr. Jayme.
I'm Stephanie.
And we are the dynamic duo here at New Journey Chiropractic. One of our favorite things to teach is to teach people about the perfect storm, what it means, how it comes, and how it can impact your overall health. So, tonight we're going to teach you what the perfect storm is, things that you can do to manage in your health, in your family's health and wellness, and let's get to it. So, if you don't know about me, I was a nurse for 10 years before going to chiropractic school. I knew from a young age that I wanted to help serve the community, help serve other people. I remember being 5 years old and putting a band aid on my grandpa, and that kind of sealed the deal for me. I knew I was meant to be a healer. And so throughout my nursing career, my passion was just to serve and to help people get well. But there was a point in my career where my life was transformed through chiropractic. So, on the slide in front of us is my family. You see a lot of pictures of my son, and the reason why I'm a chiropractor is through my son, Bradley. So, Bradley was 4.5 months old when he developed his first ear infection. Being a nurse, I tried to manage it at home. He developed a fever, took him to his pediatrician. At the pediatrician, he got his first ear infection diagnosis. He got an antibiotic. He took that antibiotic for 2 weeks. Ear infection went away, fevers went away, life was good. Couple of weeks later, he developed his second ear infection. This time we get a stronger antibiotic. It's not in the left ear, it's now in the right ear. So he takes this antibiotic for again another couple of weeks. Ear infection clears, and about 6 weeks later, he develops his third ear infection, but it's both ears. So we deal with this diagnosis on and off for the first 2 years of his life. You know, it's common that kids get ear infections, they take antibiotics, and that's just what happens as a baby. So around the age of 2, we just started noticing that he wasn't hitting the milestones like his sister. So our daughter Abby is 2 years older than Bradley, and by 2 she was talking, she was just doing more things. And so I became concerned as a parent, took him back to his pediatrician. Pediatrician sits down with me and tells me that due to his numerous ear infections, it might be time to send him to a referral for an ENT. So we get the referral. It takes a couple of months for him to get the referral. So I take him in. ENT agrees with the pediatrician's recommendations. He schedules him for surgery. So, right after Bradley's third birthday, he has tubes put in his ears. He is also the ENT's recommendation was to also take out his tonsils, remove his adenoids, because they told us that that would fix and correct the issue. So we did the surgery in the recovery room. Surgeon came out, told us everything went well, told us that in a couple of months we should see an improvement. Well, a couple of months go by, still no improvement. So Bradley is now probably about a little over 3.5 at this point. Still not talking, still not communicating. And at this point, our joke is to say that he's a tyrant, but he's difficult to manage. He's frustrated, he's acting out, still not talking, so behavior is just off the charts. So I take him back to his pediatrician. Pediatrician tells us that he's fine. ENT tells us that the surgery was successful. Now we get a referral to behavioral health counselor or behavioral health person, because now Bradley has a behavior issue. So now they're running him through lots of testing. We're starting to hear potential diagnosis of autism, somewhere being on the spectrum. Guys, at this point, I'm losing hope. You know, I still have a 3-year-old that I'm parenting, I'm helping, and all I'm hearing is that they don't know what's wrong with him, that it may take us years until we get an official diagnosis. And the only recommendations that they have at this point is putting him on a medication. And so I'm frustrated. I start to call family, start to give them updates on what's going on. And, I happened to call my brother in law, who was in chiropractic school at the time. He had been begging me for the last 2 years to take Bradley in to get him adjusted. And at this point, I was just at my wits' end. Like, I didn't have any, not that he didn't have any other choices, but the choices besides medication was to put him through therapies, which would be speech therapy, occupational therapy. And while I didn't necessarily think that was a bad idea, I just didn't think it was the only answer. And so started having conversations with him. He tells me that, at this point, what do I have to lose? So I take Bradley in, and guys, after all of the appointments in nursing school, anatomy and physiology, and all of the things that I had learned over the years, this is the first time someone ever sat down, listened to my story, listened to what was going on, and actually sat down to educate me on what health is, where it comes from. And it really just kind of clicked. So he starts talking about the pressure in the upper cervical spine. And you guys, it's like way over my head, but it's almost like it made sense. And so um, he's recommending Bradley start getting adjusted. And so Bradley gets his first adjustment. I would love to tell you that after that first adjustment, we saw miracles. The only thing that we saw is that kid went from like a 9 out of 10 being off the charts to a kid that was maybe at like a 7 or an 8. But what that meant for him is that he was calming down, and he took a huge nap. And all jokes aside, if I could take him for a nap every single day after an adjustment, I would have done that. Because when I say that kid was a tyrant, that kid could climb the ceiling if you allowed him. But the cool thing is each time he got adjusted, we saw just a little bit more of a glimpse of Bradley and a little bit more of a glimpse of someone that was easier to manage. And right around the 6-week mark is where we saw, I would say, our biggest breakthrough, and Bradley formed his first word. And it was almost like from that day forward, it was like someone just turned on a light switch and Bradley's life was forever changed. He started talking, he started communicating. He talks way too much now. He's 16 years old. He has a car, he's driving, he is a junior in high school, he is working. Like, guys, it's everything that I ever dreamed of as being a parent, was to be able to see my kid meet these milestones. And had it not been for chiropractic, I'm not necessarily sure that he would have had the opportunities that he has right now. And so when I look at where my path could have gone, I don't know obviously where the other side would have gone, but I can only imagine what medications he would be taking. I can only imagine what his behavior would be. I can only imagine like what obstacles we would be still working with. And so, I want you guys to just hear that there's hope. I want you to hear that the body has a capability of healing, and that, that there are other alternatives to what we currently view as our current healthcare system. And so, guys, that's my story. That's why I get passionate about taking care of kids. I want to be the person that helps that child reach the milestones that they were given, and I want them to reach their God-given potential, because there's no limitation on what we can and can't do. And so we want to be able to be that resource for you and for your family. And so tonight, I hope you're able to take away just bits and pieces or whole stories of what the perfect storm is. But I hope that you're able to learn something tonight and be able to take that information and apply it to your family's health and overall wellness. And so, the way that we view our health is that you have options, right? There are 3 typical options that we look at in our overall healthcare. It's traditional, it's medical, so it's going to be seeing your primary care doctor, it's going to be taking medications. And guys, I want you to not like take that the only thing that I'm saying is that never go to your primary care doctor. What we teach in our practice is that there is a time and a place for everything. If you have an injury or you have high blood pressure or you have something like you're sick with a cold or an ear infection or something like that, there needs to be a medication. Then God forbid, like go and see your primary care doctor. That's why they're here. But what we tend to see is everybody steers to that first
fixing a problem instead of preventing it.
Correct. So we're very reactive with our healthcare versus proactive with the healthcare. And so, the second option would be to see a functional medicine person who does integrative health care, who is holistic, who is more on the natural path side. As a culture in the United States, we have the world's best medical care. We're leading in research. We have the most pharmaceuticals. We're leading cutting edge in surgery. We have all of these wonderful things, but our healthcare is also incomplete. And what we also need to realize is that as a chiropractor or as a functional medicine provider or as a traditional medical doctor, we need to work together as a team because there is a time and a place for medicine. And I can't stress that enough. Like, I never want someone to be in this office feeling like they can't see their primary care doctor. Go, let us just work together. Let us be part of that team. And so the third option that you have with your overall healthcare is having neurological based chiropractic care. We're not the center of everything, but we are part of this overall team and getting you to your fullest potential.
Our goal is to help you heal, unwind what caused your symptoms in the first place, where we see a lot of our patients, they come to us in pain, and pain is a symptom. So a lot of medications treat symptoms, but they're not going back to the root cause. Right. And we'll get deeper into this as we go through this tonight, but we're part of a team that can help you not only get healthy, but stay healthy and help lead you to other practitioners that maybe you don't want to be on prescriptions, or you want to learn how to have a more holistic and natural lifestyle, or you just don't know. I mean, we've heard it 1,000 times. We don't know what we don't know.
Right.
So we like teaching from this standpoint because it gives you some ideas that maybe you hadn't thought of, or maybe you have, but you weren't sure. So we're just here to answer some of those questions.
I mean, going back to my story, it's like, when your child has an ear infection, you take them to their doctor. Who knew that the chiropractic adjustment would have such a big impact on Bradley's overall health and wellness? What if I had started chiropractic when Bradley was sooner? There's so many things that I didn't know being a young parent, but also now knowing the things that I know, wishing I would have tried other things sooner. But hey, that's not the gist of the perfect storm. We're going to teach you some things tonight. And so we're going to watch a video.
This is an awareness test.
Let me pause it. So in the video,
how many passes does the team in white make?
There's going to be a team in white and there's going to be a team in black. Your job is to count how many times the team in white passes the best.
The answer is 13. But did you see the moonwalking bear? This is an awareness test. How many passes does the team in white make?
Go! And so the reason that we like to share this video is because we want you to get to the cause. We didn't see the
The
bear to
answer is
begin with,
13.
but now that you do, you can't
But
unsee the bear,
did you
right?
see the
And
moonwalking
so what
bear?
we want to do is get you to the sequence of knowing where stress comes from. And there are triggers there are triggers of stress in early development in the brain that can lead to things that can impact your overall health and wellness later on. And so, what we talk about in our practice is this
This is an
moonwalking bear. Like,
awareness
what
test.
is the root cause of somebody's
How many
illness,
passes
or
does
what
the
is
team
the
in
root
white make?
cause to diseases? And so, as an adult, we look at things that typically bring us to the chiropractor. It's going to be pain. So it's going to be neck pain or back pain. Well, one of our favorite things to do is to teach people
The
that
answer is
chiropractic
13.
is for the whole entire family. And
But
so when we
did you
start
see
talking
the
about
moonwalking
kids,
bear?
some of the things that we see in a child isn't going to be neck pain or back pain or headaches. It may be softer signs like child isn't sleeping well, child may have colic, child may not be able to breastfeed, they might have tummy issues or constipation. And so those are some of the things that we see in a child that would be different
This is an
from what an
awareness
adult would be
test.
experiencing. And so, what is the overall story tonight? We're going to be teaching you the perfect storm. And so, this is going to be the sequence of stressors that lead to disease or to sickness. And what we've noticed is that there has been a dramatic shift in our culture to look for the cause of the problem. So long, we've been basically band aiding it, covering up symptoms, taking medications. And again, don't leave this recording thinking, oh my goodness, I can't ever take a medication, because they're there for a time and a purpose. But the problem is we tend to use those medications to mask the symptom for longer. And so, or for however long you're taking it. And so tonight we want to teach you about stressors that can lead to the perfect storm. And so the very first thing that we're taught as a chiropractor and as a provider is we're talking about genetics. And so we learn all about genetics and how it impacts that person. It can curse a family. If there's a family history of it, then you're more likely to have it, or the doom and gloom, like you're going to have this problem. And so what we tend to do as a chiropractor, as we reverse things, we can start to see these genetic things. I don't say they all go away, but we can start seeing things not happen. We're changing patterns. And often as a child, providers will often say, like, don't worry about it, they'll grow out of it. So kids don't often grow out of things, they grow into things. And so they don't grow into ear infections, they grow into other challenges and a different diagnosis. So going back to Bradley's story, he didn't grow out of ear infections. He grew into behavioral issues. He grew into having difficulties communicating. He grew into other concerns. And so, what we call it is different things, but it's because we have different diagnoses. And a lot of the times, doing an intake on our new patients, we're also starting to look at the cause of the issue. We try to rule out toxin exposure from foods that we eat, or the environment that we're exposed to. I mean, think about it. All of the times that we have our new patient paperwork, they're like, why do you ask all of these things? Well, it's not just about why you're here. It's how did you get here? Not just calling the phone and figuring out, picking New Journey Chiropractic.
Yeah.
But it's,
we can eliminate the pain, but we're looking for those root causes.
Right. So 60% of the time, what we see is that there's a significant amount of stress on the family. And if we look at children, it relates all the way back during that pregnancy period. So I'm going to go into each and every one of these. We often have to go backwards before we can go forwards. So if there's stress on a mom during pregnancy, whether it's work or it's life or something else may be happening, what we do is we place fear on the mom during this critical time of growth for this baby. If mom is stuck in fight or flight, then during this time, this stress can create the baby to get wired in that fight or fight pattern. And so 85% of cases, there is a medical intervention during the birthing process. During the birthing process, that could be inductions, that could be forceps, it could be a vacuum delivery, it can be a cesarean section. This amount of significant amount of stress can place physical stress on the most precious, unprotected neurological channel. And so we always teach that we have completely changed the way people view pregnancy, and they view labor and delivery. And, we also use these interventions during delivery, and it's a normal issue, or it's a normal thing. So thinking about whether you've had a child, or a family member has had a child, like how many times have we talked to parents or talked to moms, and it's like, oh, I had a C-section. Oh, wow, tell me about that C-section. Well, I was 38 weeks pregnant and it was time, so doctor scheduled a C-section.
Or doctor was going to be out of town and I wanted to have the baby with my doctor there, or timing, or
I wanted this birthday, and I didn't want to go in on a Friday. I wanted to go, like, God knows what the story is. But the other thing is delivery halts, or labor halts. And so what do? They need to help get the baby out. So they use the vacuum extractor. They use forceps. They just needed to get the baby out. And so it's no big deal, right? But when that happens, the child may have issues, let's say, turning their head, or they have issues that lead to feeding problems because neurologically, that was what was impacted or affected during that intervention. And so what we continue to find is subluxation in that upper cervical region. What we then see is a non-soothing, constipated, colicky baby. They typically don't grow out of this. They grow into other things. And so in elementary school, the child may be labeled as ADHD. They may have anxiety as a teenager, or they may have a sensory processing disorder because of that neurology that's impacted in that upper cervical spine. And so there isn't a difference in the neurology between one child to another. There's a difference in a diagnosis, and that tends to be where we sweep things under the rug. It's Johnny has ADHD. That's why he behaves this way. Or Sally or Susie has blah, 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 blah. And that's why blah, 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 blah happens. And so the way that we are designed is definitely intricate. That's the way God has created us. I've studied it for over 8 years as a chiropractor. And I can tell you I know the very minimal of that. And so what I do understand is that it's pretty basic. The way that we are based as a baby is based on two things. It's based on plumbing and it's based on drainage. And so this is the foundation of the brain, and the foundation of the brain is based on movement, and it's based on like the neurology is based on that foundation. And so we try to make it intricate because, again, the body is intricate. It knows what it needs to do at any given moment, at any given day. But if you take it down to the basics, this needs to happen in order for this to happen. And those are the two things. And so when we look at the upper cervical region, if it's, if you will, messed up, or if there's something that's creating a disconnect between that brain, between that body, and there's a disconnect, then we start to see issues in children where there's a drainage issue. So just basic anatomy, if there's issues where fluid's not draining in that upper cervical region, or in the eyes, the ears, the nose, the throat, the lymphatics, what tends to happen is that fluid gets built up. We develop an ear infection. We develop sinus issues. We get a sore throat. We get a cough because it drains into the lungs. And so it just becomes this perpetual issue. And so the way that we were designed is from the top down, inside out. And as long as there isn't a blockage, a clog, a kink, things that we can't get out of, we'll grow, like we'll be able to manage overall health and wellness. And so, when we start talking about sickness, or we start talking about how the body is functioning, if we look at if you're exposed to a foreign body like a bacteria, we know that it needs to get out. And so think of it this way: if you have a sinus infection, our body's going to create extra mucus. This extra mucus is going to allow that foreign body to go through the lymphatic system into the gut, which is acidic. It is broken down and it ends up to where. So that's how our body was created. We make it so much more difficult because we were exposed to whatever.
Well, and I think too that a lot of parents just know that if they go to the pediatrician, they're going to be given an antibiotic because that's what they're told. They're told the only way to fix this is with an antibiotic, because that's what happens when you have infection. So when we have infection, it's typically because there's lack of drainage, right?
Right.
Would you say?
Right.
And what happens if you have stagnant fluid?
It gets infected.
Bacteria.
Sorry, I'm trying to fix the light here.
I was trying to cover for
Our lights went off. No, so yes, if you get fluid, like let's think of a puddle. If the puddle's outside and it sits there long enough, it gets stagnant. If it's stagnant, then it starts to collect bacteria. If the bacteria starts to grow, it starts to stink. We start to have bugs, and it just becomes this perpetual issue, right? So if we put that back to the body, if we have a clogged drain, or if we have our lymphatics aren't draining things properly, or there's fluid in our nostrils or in our sinus cavity, it's going to run into our ears, which can lead to an ear infection, which can lead to a higher temperature in the body. The higher temperature is going to make you not feel well because the body's trying to rid a bacteria. And again, we're going to simplify this because it doesn't have to be complicated. And so when we start having that clogged ear or that clog in the lymphatic system, you go to your primary care doctor, or you go to urgent care, or you go wherever, and the doctor is going to prescribe you antibiotics. He's going to prescribe you steroids. And it's not that it's wrong, it's just that you're not given other options. And so what tends to happen is you take that antibiotic, it's going to create havoc on your gut, which, by the way, 80% of your immune system belongs in the gut. And we also know that there is a connection between the gut and the brain. And it's, that's another topic for another workshop. But there is a huge connection between the gut and the brain and how it communicates. And so what tends to happen is not only are you impacting the bad bacteria that got the ear infection to begin with, you're now destroying and wreaking havoc on all of the good bacteria that resides in the gut, and you're creating issues for potentially in the future. And so what we see is that antibiotics limit the function of both, because 90% of the neurotransmitters that calm us down also live in the gut. And so steroids will stimulate the sympathetic nervous system. And so we'll talk about it in the next slide, but then our gas pedal gets stuck on fight or flight. We're going to go through like the different bullet points here on the slide. But first thing is that there's a significant mental or an emotional stress during the prenatal period. It can lead to medical interventions at labor and delivery. We talked about it earlier, like forceps, vacuum extraction, a C-section. Then a baby comes out, they're stressed, they're stuck in fight or flight, they're colicky, they become constipated. If that isn't corrected or managed from an earlier age, then it can lead to being sensory overload. They're continuously sick. They're a challenging toddler. Fast forward a couple of years, now we see a child that's on the spectrum, or they're hyperactive, or they're just emotionally stuck as a child. They get into their middle school years, they become an angry, anxious, depressed teenager, and then fast forward as an adult, they're stressed out, they're anxious, they have ADHD, and it's just, if you look at the sequence, it's like one is impacting the other, and then the other one is created. And so when we look back at the chart, number 3 starts, then number 4 is diagnosed after they are usually about 3 years old. All of this, the time that the brain and the nervous system are significantly and rapidly growing. A child develops more neurons in a day in their first 3 years of life than you and I would even do in a year. And so what we're doing at these children, or during this time that the child is rapidly growing and adapting to its environment, is we're giving them antibiotics, we're giving them steroids, or we're impacting how their body is functioning just from managing a simple diagnosis like an ear infection or a cough, or whatever the diagnosis may be. And so the brain is also the most plastic during this time frame. And so most of the time we don't want or we don't know that there's an issue until we get that quote unquote diagnosis. And so I know many of you have been trying anything and everything, and I'm not knocking or discrediting anything that you've tried, because I've been there. I've done multiple things to try to help Bradley, or I did multiple things to try to help him. But the things that I did wasn't what was correcting and fixing the issue. It was just masking the symptoms. And so what I do know is that the gut and the nervous system have been impacted. And if we don't get to that, we're going to create more damage. And what's going to end up being impacted is his overall, or your child's overall neurology, and even yours. So
it's pretty amazing that when learning all of this, my girls struggled with ear infections, and it never failed. It went from one ear to the other ear to both, which led to a cough, which led to mucus, which led to tummy trouble, which led to potty trouble, which, like, looking back, everybody thinks, oh, this is just, it's normal. Well, and then as adults, what happens? They get labeled. Actually, they get labeled in elementary school now.
Yep.
Like, this wasn't a thing
No.
when I was in elementary school in the late 70s and early 80s. I'm dating myself now. But think about it. ADHD and sensory issues were barely even heard of 10, 15, 20 years ago.
Yeah.
Our genealogy has not changed that much over the last 10 years. It's environment. So you probably heard nature versus nurture. But again, if we go back to the neurology, that was there first. The body was designed to be perfect. The body is designed to heal itself. All we have to do is correct the environment.
And remove that interference. And once you remove that interference, then the body can adapt, it can thrive, and it can manage the stressors that are thrown at it day to day. And so, as promised, we're going to go over the gas versus the brake. And this is a great visual to talk about when we look at chiropractic and the nervous system. And so in chiropractic, we look at 3 things that can create stress on the nervous system, and it's thoughts, traumas, and toxins. What we focus on in chiropractic is stress that's being applied or being created in the nervous system. And so what we know is that 99% of the time, our body is in autopilot. It's managing so much. It's not only allowing your heart to beat, it's allowing your lungs to breathe, it's your eyes seeing what's going on, it's making sure that there's a bear that isn't chasing you, it's making sure that the building isn't on fire, it's making sure that the lights are on, that it's hot, that it's cold. Like, it's doing so much. But what happens is when we get stuck in whatever pattern, fight or flight may happen, and then that's where we get stuck in stress. And so one of the common sayings that we often talk about is that nerves that fire together also wire together. And so you want fast fuel, not slow fuel. And this is why when we start talking about kids and their diets, we want to make sure that they're eating appropriate foods or getting the appropriate nutrients. Think about kids that get stuck on macaroni and cheese and processed foods. They don't want to eat the broccoli that's being placed in front of them. They don't want to eat the healthy things like salad or veggies. And so their digestive system gets shut down. When we look at a child with ADHD, the child can't slow down. It's impulsive. They can't sit still. They move all the time. A sensory child can't stop chewing on things. They're biting on their pencil. They're touching things. They're toe walking because they can't unwind and get themselves out of the pattern. It looks like a child with behavioral issues, but they're trying to get themselves out of that stuck phase of fight or flight. If a person is stuck in fight or flight, everything from their gut to their immune system, they're going to get stuck in what we call that perfect storm cycle. And the way that we as a chiropractic office get them stuck out of fight or flight is to get their nervous system to chill and to relax. And then once we can get their nervous system to chill and relax, that's where we can start making changes in their overall health and wellness, because their body is more calm and it's more readily, I guess, adaptable, and it's ready to receive these changes so that their body can heal.
Yeah.
And so the real issue is when we're subluxated. And so subluxated is this big, long word that people never remember, even though we say it 25,000 times a day. But subluxation is just a term for stress stuck on in the nervous system. And the nervous system can shift too much to the right, or it can shift too much to the left. But the real issue is whether it's too little or too much, we're going to get stuck in this pattern. And so if you're stuck in fight or flight, we have issues. Mm-hmm. If we're stuck in the opposite, which is the parasympathetic state, which is the core to resting, calming down, and digestion, like if we're stuck in either one of these patterns, the body's not able to adapt to what's being thrown at it on a day-to-day basis.
So a lot of you have heard us talk about fight or flight and rest and digest. Mm-hmm. So when we look at this this graphic, it's my favorite. This is my wheelhouse. This is my jam. When patients come in and I can actually measure their nervous system, patients that are stuck in fight or flight are patients with, if they're kiddos, we hear ADHD, we hear behavioral issues, we hear digestive issues or colic with babies. With adults, it looks like anxiety and stress and depression and just chronic health concerns.
Can't sleeping at night, have pain, have headaches, have migraines.
Yeah. Like it's just this recurring thing that like, oh, I have chronic heartburn, I have chronic headaches, I don't sleep more than 2-3 hours a night, I have high blood pressure. And it's like, yeah, I can already tell you where you're going to land on this chart because I hear it through thoughts, traumas, and toxins. Mm-hmm. And when we look at the history, we're like, oh yeah, how many fast food meals are you eating? Or are you eating fruits and vegetables? Are you drinking water? Are you drinking coffee and sodas? Like, I'm not saying that it's bad, and we do not shame anybody for any behavior. But if you've heard me say it once, I've said it 1 billion times. When we know better, we do better. So we all know that broccoli is better than French fries, but French fries usually taste better. What? I know, such a shock. But when you can put your body in a state of balance between gas pedal and brake pedal, then what happens is now the body can heal itself. Now the body can start to unwind some of those areas that have been stuck for so long. It's like a rusty spring. Lubricating it, getting it movement, like it starts to release and you start to feel better, which eliminates symptoms. Mm-hmm. And then we're getting to root cause. So when you're thinking things that make you stressed out, like I have all this work to do, I have deadlines, I have financial issues, whatever that is, those are your thoughts. Toxins are the things in our environment that are not healthy for us, whether it's internal, whether it's external, what you eat, your personal care products, anything that you drink, anything that you're exposed to.
Your perfumes.
I mean, Even household
laundry
cleaners,
detergents, like
air fresheners,
yeah.
like these things literally mess with your endocrine system, and it's basically clogging up the plumbing. So we talked about drainage and plumbing. Those things have to continue to work in order for us to continue to heal. So when patients come in and I show them their testing results, they're like, oh, yeah, absolutely.
How'd you know that?
Yeah, I could literally go, so you XYZ. They're like, yeah. And then we can start to unwind that. And then what happens is people just start to feel better. Your body cannot heal in a state of stress. So if you are stuck in stress, you are never going to eliminate those root causes.
So you talked about thoughts, trauma. Did you talk about traumas?
Oh, no, we didn't talk about traumas.
I was like, wait a second.
So traumas don't even have to be big T traumas. Like they don't have to be car accidents. They don't have to be injuries or slip and falls, but they could be as minimal as you not sleeping. Right. And you being up for 16 hours a day trying to live on 3 hours of sleep and 4 Starbucks. So
it can also be micro traumas.
Yes.
So think about what you do day to day. As an adult, you might sit at a computer 8 to 10 hours a day.
Or in your car.
Or you may work in something like factory or whatever. Mm-hmm. Or, God knows what it is, but that repetitive movement can create micro traumas on the nervous system as well. And so it's not just major accidents like slips and falls or car accidents. It can be those micro traumas as well. And so we often talk about the vagus nerve, how it controls sleep, how it controls digestive, how it slows down the heart rate. We also know that this is where it controls the sensory and motor portion of our nervous system. It regulates our emotions. And so one of the biggest things that chiropractic stimulates is that vagus nerve. So it can get us out of that gas pedal being pushed down, being stuck in that fight or flight, and allowing us to get more into that restful state where your body can heal and repair itself. So when a person is stuck in that pattern, everything is ultimately impacted.
And again, you talked about after Bradley's adjustment, he slept.
Yes.
We call it a soft sign, but even with adults, a lot of them will say, I'll ask. And they'll be like, yeah, actually, I am sleeping better. Mm-hmm. And what happens when you sleep better? Listen, sleep deprivation is used for torture because it's effective. Uh-huh. If you're not sleeping, your body is not healing. It is not digesting. So the food that you're eating, if you've ever eaten a meal and it felt like a rock in your belly, that's because you're in fight or flight. Right. It's because your body physically cannot digest your food because it's sending all of its energy to your extremities because your brain doesn't know the difference between having stress at work and being chased by a bear. Right. Even a moonwalking bear.
Right. He's so cute. So one of I ran across this quote a few years ago, but it says the function of the nervous system is to perceive the environment and coordinate all behavior of all of the other cells. And so that's by Dr. Bruce Lipton. And so we've talked about this in the previous slide. It's like when your body gets stuck in fight or flight, it's where we start to get into trouble because we're not reacting to things neurologically appropriate, and it can lead us into trouble. Body, as what Stephanie said, is like it doesn't know that it's not being chased by a bear. It doesn't know that this is a safe environment. It's constantly trying to figure out where the next invader is going to be and how it's going to affect you. And so when you get stuck in the fight or flight, it can lead to increased stress. And we know that if the body has a lot of stress, it's going to have more inflammation. If there's more inflammation, then the body's not healing. And so this is where we start to see issues form. And so one of the things that they talk about with a child that is on the spectrum or a child that has autism is it's described as a locked-in syndrome. And so we now look at it as basically a locked out syndrome because that child gets stuck in fight or flight, which leads them to anxiety or fear. And now they get locked out of life. So they miss out on friendships, they miss out on communication, they miss out on life experiences. And so the challenge that we see is that the nervous system isn't able to perceive the environment appropriately. And when you alter perception, the brain gets confused and it makes about a bad decision, and it makes a bad decision out of outcomes. And so we are constantly perceiving everything that's going around us. And there's about 300 trillion bits of information each second, and only recognizing 50. Not 50 trillion.
Yeah,
it's 50. So like, as I mentioned earlier, like your body is sitting here, or we're sitting here, the lights are on, the door is shut, temperature is okay, it's a little chilly today, we have a blanket, but it's perceiving that we're in a safe environment, we're able to do this webinar and be able to have these conversations. But someone who is stuck in that pattern of fight or flight, they're not able to perceive this. So any little movement can set them off, or any little
even just
noise.
Even just the act of sitting still sometimes. If you know somebody, adult or child, that can't be still, the body won't allow it. It's not because they don't want to pay attention, but we're so sensory overloaded to start with as a society that we're already predisposed to it from infancy, either prior to becoming earthbound, if mom was stressed during pregnancy, or during the birthing process. And then think about what we're doing now. Our kids didn't have these, but kids have screens now.
Cell
We have
phones,
screens
tablets.
Now. And what happens? You're standing in line or sitting at a red light. What's your first option? Grab the phone. I can't sit here bored for 5 minutes.
Or 2 seconds
or
waiting
2
for the light to switch.
So we're very desensitized to this. But again, think about that. We're only recognizing 50 of 300 trillion bits of information.
In 1 second.
In 1 second. All day, every day. No wonder we're loopy sometimes.
So what we also see is altered perception, or that subluxation, equals altered function. And so if the motor unit is affected, then it's going to affect the gut. It's going to affect your immune system. It's going to start affecting speech. It's going to affect social behavior, behavior overall, and it's going to affect emotional issues. And so brains are built from the bottom up, back forward over time. And when the neuromotor system is altered, then everything is altered overall. And so what we tend to see is that subluxation alters perception, which then alters function. And so perception is the first function in every key function in the body. And so the most important thing to develop in the child is that motor system, which is movement. And what we've seen recently is that they've changed the motor milestones chart, which means that they're sweeping everything under the rug and creating that perfect storm. And it's not because they don't want to recognize there's a problem. It's just, it's easier to ignore it than to address it. And so we mentioned from previous slides, remember there is a time and a place for medicine, but we can't ignore or change things if we don't address the issue to begin with. So just changing a timeline of a baby sitting to walking isn't going to fix the issue. If you delay it, you're actually causing more of a bigger concern, because that motor unit is so important. And so what we often see is that a child working with a therapist who's in physical therapy, occupational therapy, or speech therapy, is that the child is often diagnosed with low tone and they have fine or gross motor issues. And so what the PT, OT, or the ST recommends is for them to strengthen their tone, and that will create better proprioception and that stimulus to the brain and the nervous system, which is correct. But before someone can have that low tone or that hypertonia, there has to be high tone first. So their body was already stuck in that pattern. And so what tends to happen is if there's a subluxation, then that entire neurospinal structure goes into a state of protection because of some sort of injury. So as a chiropractor, we're trained to think of the neurospinal structure as muscles, ligaments, and bones, but it just so happens that inside that structure is the brainstem, the spinal cord, and the spinal nerves. And so we've said this a couple of times, just even on this webinar, that we're designed perfect. Our body knows what it needs to do at any given moment. And so if a system is the only system in the body, or if the system is the only system in the body that is fully encased in bone, from the skull to the vertebrae, our nervous system is super important because it is encased in that protective armor. And so the central nervous system tone is controlled by too much tension, but this is this blows a fuse in subluxation. It tends to send somebody into that fight or flight pattern. And so if we can get back to that root cause and we can get back to that motor unit, then we can help impact all the other systems overall.
Yeah, so we talk a lot about like fuse box or gas pedal and brake pedal. We're always talking about the nervous system. Everything goes back to the nervous system. And, obviously because it's encased in bone, it's protected. And it needs to be protected because
it's important.
It runs everything. So when we talk about fuse box, that's what we're referring to. But I just love that description because I think it gives us something that tangible that we can understand as a society. Even if you don't understand all of what we're talking about, you understand when there's a blown fuse, not everything works. And it puts more stress on everything around it.
And so no one looks more at this than chiropractic or as a chiropractor. And so when we start with low tone, there has to be high tone first, which then leads to motor, gut, immune systems, and so or immune issues. I'll get it out eventually, and so on. So the hierarchy of neurological health and healing has 3 simple steps in the sequence. So it starts with the autonomic nervous system, then the motor system, and then the gut immune system. So if we're not impacting it in that hierarchy, then we're not impacting the health and healing that your body can or cannot do. So this is a slide from Harvard. It's talking about the interaction of genes and the experience and how it shapes the developing brain. Although genes provide a blueprint for the formation of brain circuits, these circuits are reinforced by repetitive use. And so cognitive, emotional, and social capabilities are intertwined throughout life. Toxic stress weakens the architectural of the developing brain. So we talked about a mom who is stuck in fight or flight or dealing with significant stress during pregnancy and how that can impact that unborn child. That developing brain is now impacted, which can lead to lifelong problems such as learning, behavioral, and physical, and even mental health overall. And so when we have a weakening from earlier stress, it affects the architecture and development, and then the motor system is affected, which is needs to be impacted first. And so this is a super nerdy chart. You can read it as I talk, but it's going over the development of different sensory things. And so when a baby is little or as an infant, they're watching and coordinating everything. So think about a baby when they're 4 to 6 weeks old. They're starting to acknowledge the external world around them. And so that's where they're starting to see or they're starting to develop the perception of what's going around, coordination, and then the expression of overall life. This is why we can go back to the basics. The first thing is that when a baby is working well, they're eating, they're sleeping, and they're pooping. And so if they can eat, sleep, and poop, then that means their nervous system is functioning. And then you can advance to other more complicated things, such as language, sensory, and cognition. And so everything's built from a foundation. And so when we see children and adults, when they first begin care, is that we see that they're sleeping better, they're no longer constipated. We get that from adults too, like, hey, every time I get adjusted, I'm pooping. Well, hey, great. means your nervous system is functioning better.
Yay.
But what that also means is that we know that their body now has the capability of healing different challenges because their nervous system is more connected. And so you have to fix the basics first before you can get the body to function better. You can't skip one sequence or another. And so when we start talking about the perfect storm algorithm, first we have to look at the stressors. So how much stress have you perceived? What did you go through? When did you go through it? So those 3 T's. Number 2 is the earlier that you go through that stress, the more challenges it creates and the longer it takes to restore balance. Guys, I'm the most impatient human being in the world. Like, I want it to happen before the problem started. Like, it's just who I am. But if you don't address the issues that occurred first, then you're not going to see the changes that can happen in the body overall. So as an adult, if you're dealing with headaches or neck pain, or you're like crawling in day to day to your appointments, if your body's not able to get to that root cause of that issue, then your body's not able to heal and protect itself. And so people always want to know, like, how much care do I need? How long is this going to take? I don't know. It depends on what got you here and what you're doing outside of here to get you back to that state of healing.
We're a little desensitized to healing because if you take a pill, it eliminates pain. It's eliminating a symptom, but it's not undoing it, because what happens 4, 6, 8, 10, 12 hours later, it's back again. So now
and you've probably done 25,000 things in that process because your body didn't feel the pain and you caused more damage and more problems.
Right.
Because you didn't sit on your butt and heal. So just throwing it out there. So we have this chart. If you ever want to review it, we can go over it. And so this is talking about the neurospinal system. So every nerve root and every nerve in the body has a function, or it coordinates with a different system in the body. And so the nerve serves as the nervous system, or I'm sorry, this is a quote from Dr. Tony Evil, and I'll just read it because otherwise I'm messing it up. So the spine serves as far more than a branch of ligaments and bones. It is a living, breathing, neurological communication superhighway that is vitally important to the brain, to the body, and back again. Communication, coordination, and control of every other cell, tissue, and system in the biological or physiological system. So when we look at the different systems in the body and where they coordinate back to the spine, back to the nervous system, and how it communicates back to the brain, is all going to be listed on this chart. And if you want to look at how, if a fuse is affected by subluxation, what it's going to create in the body, what symptom it's going to develop, that's the form or the chart that you can look at. And so I'm not going to go into it very deeply. Ask us. We'll be more than happy to send it to you. So
if you've ever been scanned, I have one in the office in the exam room. It's a fun thing to look at while you're sitting there getting your scans
People
done.
Like, I didn't know. Well, it is. So subluxation, we mentioned earlier, is stress stuck on. The next section, we're going to talk about the D's of subluxation. And so the first 5 D's in sequence is going to be dyskinesia, which is abnormal alignment and movement, leads to disafferentation, so an abnormal sensory input, dysautonomia, which is an imbalance of the autonomic nervous system, leads to dysfunction, which is an interference in optimal or key function in systems, or dyskinesis, which is an abnormal energy expenditure and output. And so this is where things get stuck on, and 60% of all movement and stimulation comes from the spine. And so 1/3 of it comes from the neck. If we're not getting movement from our neck or our spine, then we seek movement in other ways. So think of a child who is stuck in subluxation. They're grinding their teeth, they're tapping their feet, they're touching things, they're getting into things. Then dyskinesia starts with the challenge that leads to disafferentation. Disaffrontation is going to be abnormal perception. Dysautonomia is going to be that gas versus brake pedal. And this is where this nervous system shifts into that fight or flight or into that parasympathetic state. Dysfunction is then where things break down. You're not functioning well. Dyskinesis is going to be abnormal energy output. This is where a child can't sleep and a parent is ultimately exhausted. And so these are the neurophysical or physiological elements that we need to find. We need to address them and to correct them. And so, how can one thing cause all of these things? Well, I'm going to go over a video with you that's going to start from the very beginning of how a child can be brought into this world. And so, this is going to be the
irritated. Oh, there you go, little fella.
Come on, buddy.
All right.
This is a cesarean.
Ears of a girl.
I regret to warn you. This may be difficult to watch. Cover your screens or
Make
close
it
your eyes
cute
for a
the
second.
camera.
What I've found is that time after time, a nurse or a chiropractor
There you go.
may not know that this
Irritated.
is what happens, or like they're kind of
Oh, there you go, little fella.
I was
Overwhelmed.
shocked. I saw this in this video. It was years ago.
Ears of a girl.
I was utterly blown away at this is how babies are born by
Ears of a girl.
cesarean section.
Make you cute for
So
the camera.
what I've seen is, as a nurse and as a chiropractor, that if we have an answer, there has to be a solution. So I'm gonna just show this to you. Just watch it.
Getting irritated. Oh, there you go, little fella.
Come on, buddy.
All right. Ears of a girl. Ears of a girl. Make you cute for the camera.
Oh, man. Keep coming back.
So I know what you saw. I know what you can hear. We can see the baby being pulled out of the mom's abdomen. We can see, of course, that's happening.
Come on,
We
buddy.
can see everything. We can hear everybody doo-doo, whistling.
Ears of a
Like,
girl.
life is great. But what do you think? What did
Ears
you
of a girl.
notice?
Make
What
you
was
cute
the
for the
moonwalking bear
camera.
in
Oh, man.
this video?
Keep coming back.
So it's easy to miss if you're not looking for it. And so the fact that people don't know, this is why I'm here. Guys, the amount of pressure that's applied to the nervous system during this time of delivery is insane. We watched that baby being delivered from that mom's belly by the hands of the surgeon. They were picked up by the head, they were twisted, they were rotated, and that child was pulled out. Now, that amount of pressure is insane. This amount of pressure and tension creates a sequence that matters more. And so, guys, what I'm here to tell you is, Bradley was not a cesarean delivery. He was a forceps and vacuum extraction. The nurse midwife that delivered him, I didn't know this until I was in chiropractic school and actually reflecting back on his delivery, but she was in a hurry. She had a lunch date. She made it very well known that he was going to be born within a few minutes. I mean, she walked into my room at 9:00 and he was born at 9:45. I'm not blaming her for this, but now that I know better, I can do better and I can teach other people. And so this is the pattern that we saw in Bradley. He had difficulty latching. That led to ear infections, that led to ear antibiotics, that led to surgery, and that led to his diagnosis of being on the spectrum or having those developmental issues. And so if we're not looking for these things early on, then we start to see these kids that are wound up and uptight. And so one of the things that's happened is that the cesarean rate has completely changed over 1 to 2 generations. And so we've also changed how we manage birth. We talked about it earlier. A child may be delivered by a C-section because
doctors are going out of town. Parents want a specific birth date. Like, you can literally, and we're hearing it sooner and sooner in pregnancy. Like, moms that are 5, 6, 7 months along have already planned it. So instead of having a birth plan A, birth plan B, and then a backup plan, and then a backup for the backup, they're just going right to scheduling C-sections.
Yeah. And so we had a mom, 4 or 5 months ago, she was just distraught because they were already talking about a C-section and planning that C-section at 32 weeks. The baby still had 2 months to grow, and we're already talking about how the baby's getting evicted before it's even time to start talking about it. And it's normal because our providers are talking about it sooner. And so we're not going to bash on this. We're going to just kind of keep going. But if you need references, take a screenshot of this. This is where all of our documentation is coming from. And these aren't just little articles on the interweb. Like, these are our big, well-known medical articles that are in the community. So I'm going to advance the slide. If you need it, we'll give it to you later. So what we're starting to see is that 99 out of 100 infants, at least one of them have a pattern of subluxation. And so this is an article that was found, and it talks about kids that are diagnosed with subluxation from that first day of life. And so when you're talking about that amount of subluxation that's being applied, or that is occurring in an infant, why aren't we getting our kids checked sooner rather than later? Why are we waiting till that ear infection occurs? Why are we waiting to that diagnosis of autism or ADHD or God knows what it is? Like, why are we waiting to impact a child's life before? Like, why do we have to wait? Like, why can't we get there sooner? And so this is why I'm so passionate about helping pregnant moms, teaching them about their nervous system, how it's impacting their children. This is why one of my favorite things is to see a newborn baby that's coming in. Like, oh my goodness, we love the little babies coming in, because we get to be part of that child's healthy start to life. And so that's more exciting to me. I love you adults. Like, I love helping with your neck pain and your back pain and teaching you all of the amazing things about the body. But if I can impact one child that doesn't become Bradley's story, then I feel like I have served my purpose in life. And I wouldn't be so passionate about what I get to do had I not endured Bradley's story. But I can also tell you all of the heartache and the hurt that came from that. I want to make sure that another family doesn't have to go through that. And so we talked about the gas versus the brake. But what we also need to go into is that you can't be in growth and protection at the same time. The body has to prioritize one versus the other. And so when we're stuck in that fight or flight, it can cause issues, and it can create upper cervical spine trauma from whether it's the natural birthing process or medical intervention. But what we're also seeing is if that child doesn't have a problem or they develop other issues later on, is because of what we're doing as parents. And what we also see is not only does a child have an upper cervical spine subluxation or interference, they're also having subluxations or interference in the sacrum, which is now affecting the parasympathetic nervous system, which that child can develop from sitting in a carrier like a car seat or a bumbo seat, or just being placed in some sort of device instead of allowing them to do tummy time and to roll. And so there are things that we can teach you that can impact your overall child's health and wellness.
Yeah.
So,
We see it too in development. Kids that are always laying down develop flat spots. They develop tight lower trunks. Their muscle tone is low, which means they had high tone at one time. So, and it progresses as something different as they get older, but it all comes from the same source.
Right. So we're going to watch a video. This is not my video. I wish I would have had some videos of Bradley when he was little, but this is going to be I can talk. This is going to be a child. This is Ethan. This is from one of the offices that we work with in the Chicago area. This is Ethan. And so this is going to show.
Bye, Aunt Kristen. See you later.
No.
No? Did you have fun? Did you have fun? Yes? Yes? Do you love Aunt Kristen? Say yes. Yeah? What? Bye, Aunt Kristen. We'll see you later.
So what you're seeing here is that perception is not helping or happening.
Bye, Aunt Kristen.
He's got too much perception, like he's got too much going on.
See
He's
you
got the
later.
stimulation of his body moving in the car.
No.
He's being
No.
he's being distracted by the different noises of the car. He's looking out
you
the
have
window.
fun?
He's seeing things happening. And so when
Did you have fun?
Evan started in
Yes?
the office in Chicago, he was
Yes?
falling all the time. He was
love
banging
Aunt
his
Kristen?
head. He constantly had a black eye.
Say yes.
What they noticed is that he was he was just not processing the world around him. And so mom's
Bye,
talking to
Aunt
him. He
Kristen.
should be able to interact, but there's so much going on that his body's
see you
perceiving that he's
later.
getting agitated, he's getting irritated. And so the scans on the left
Bye, Aunt Kristen.
are showing you how his nervous system is being impacted. And so
later.
on the thermal scan, what we see is that red is considered bad, blue is considered moderate, and green is
Did you
mild.
have fun?
And so what we're seeing in his patterns is we're
Did you
seeing
have
that
fun?
there's disorganization throughout
Yes?
his nervous system. And
Yes?
so what's happening is his nervous
Do you
system
love
is
Aunt
locked
Kristen?
in. His body's stuck in that fight or flight.
Say
His
yes.
body's not able to perceive the world around
Yeah.
him. And so he's getting aggravated by his mom asking him
What?
a simple question like, do you love Aunt Kristen?
Bye, Aunt Kristen.
So
And what's really hard is like parents don't understand.
We'll
They
see
just
you
think, oh,
later.
my child just gets cranky in the car. Well, why? Because they're
Bye, Aunt
uncomfortable, they're
Kristen.
overstimulated, or they're, there's just so
See
much
you
going
later.
on that they can't perceive what's going on. And so
No?
little ones only have a couple of emotions. They either have calm or outburst.
Did you have
So
fun?
if it isn't calm, it's going to be outburst.
and the other thing
Did
that
you
you're
have
noticing
fun?
too is like he's
Yes?
probably what, 2? I don't think he's 3
Yes?
yet. He's
No.
2. But like he should be able
Do you
to
love Aunt Kristen?
answer simple things. And so I'm going to show
Say
you
yes.
a video of him about 3
Yeah.
months later and what's happening.
Is that a bird?
Good bird.
Tweet, tweet. What's that one?
Goody!
What is it?
Goody!
A dog?
Yes, I am.
Yeah.
And a truck.
What's that?
A truck.
A truck?
A fast truck.
Fast truck.
A flash. The flash. So fast. What's the truck?
What's
If
that
you
one?
notice too in the video, the last video, it's almost like he's glossed over,
No, this
like
one.
he's
What's
just
this
he's
one?
overstimulated, so he looks tired,
A
he looks
snake.
worn out, he's exhausted,
good,
and
I want
obviously
it
we
again.
don't have
Yeah.
what they did right before the video or anything like that. But what you're
Show me what-
seeing in the second video is a child that is making eye
Is that a bird?
contact. He is communicating. He's working with
Tee-tee.
things. Like
What's
he's
that
doing a
one?
couple of things at once.
Goody!
His language isn't
What is it?
perfect, but it's better. And so
A
what
dog?
you're seeing is a night and day
Yes, I
sequence
am.
from
Yeah.
And a truck.
prior to
What's
chiropractic
that?
and with
A
chiropractic.
truck?
And guys, I wish I had videos of Bradley from this time. And
Fast
so
truck.
what you see is this was the story that we dealt with. In the car, Bradley was just screaming nonstop, or if he wasn't screaming, like there
What's
was
that
no
one?
communicating or having conversations. Like he was the one that was controlling everything.
No, this one. What's
But-
this one?
Bradley went from a child that was
A snake.
nonverbal to someone turning that light switch on
Yeah.
and things kind of being restored. And so this is what
Show me what it
Evan experienced coming into the office when he first started
Okay.
care. He wasn't talking, but maybe 2 to 3 words.
Tweet, tweet. What's that
Someone
one?
turned that light switch on through chiropractic.
What
and
is
this
it?
is the child that you see. And so all that was
dog?
connecting that brain
Yes,
and
I am.
neurological
Yep.
pattern. And so when the perfect storm occurs, it's going to affect different milestones. And a lot of those are going to be the motor milestones. And so what you're seeing here is you're seeing scans. We're measuring stress and tension on the nervous system. And so if you see the patterns between scan to scan is that you're seeing upper cervical spine issues. So you're seeing damage that can happen from being in utero or through birth trauma. If you see that there's patterns in the sacrum, it's going to be from something that is post-delivery, whether it's the car seat, the infant seat, the bumbo seats. And so every adjustment that is made is used to correct, it's used to unlock and to unwind the nervous system. There is no way to stop the gas pedal, but what we can do is through the chiropractic adjustment is we can increase the use of the parasympathetic nervous system, which then allows the body to rest and to heal. And so that's what you're going to start seeing through the scans. You're going to start seeing that gas pedal that's stuck on kind to alleviate. It starts to improve. You're just going to start seeing those soft signs in that child, whether it's sleeping, whether it's being more calm, whether it's resting, whether that constipation becomes less. I mean, it's going to be a lot.
Eating more. Sometimes what happens is, and transitions too, that's a big one. A lot of times we see kids that have difficulty with transition. So like getting in the car, getting out of the car, going somewhere, leaving somewhere, sitting down to eat a meal, like the distractions are a little bit less and the transitions get to be a little bit easier.
Do you want to go over the 3 categories of the scans?
Yeah. So when we're scanning kiddos, it's a little bit different with adults, but it's really not. But with kiddos, the first one we see is drunken bull. So please understand there are no drunken children in this whatsoever. But a drunken bull is described as having a weak core. They struggle with processing. They are not really in trouble,
but they get into trouble.
They get into trouble and forgetful. So, but their nervous system is exhausted. So think about a temper tantrum for a kiddo that needs a nap, but absolutely doesn't want a nap.
No.
That you're struggling, you're fighting this and you're just like, oh, stop fighting it. But their brain can't. They can't process like, I know I need sleep. I need to relax and rest, but their nervous system can't. It's got to be wound up and worn out all at the same time.
Well, and that's one of the things, like it doesn't have to just be a kid that's a drunken bull. Like an adult can be like this. Think if they're overstimulated, they can't process things. They're not necessarily getting into trouble, but they're forgetting things. They're, you know, their body's just like stuck.
Think overwhelm.
Correct.
You know, it's like 17 tabs open on the computer and everything's glitching and I have no idea where this music is coming from. So number 2 is a raging bull, which is pretty much the exact opposite. You've got to calm them down. And these would be kids that are labeled as hyperactive, ADHD. They are wound up and they are like a spring ready to bounce. And a lot of times we see stiffness and toe walking, inability to deviate from the plan. Like, oh, we're going to do this, but now we have to stop and do. Absolutely not. You are not deviating. This is what we do. This is how we do it. They can't make those changes. And so what happens is any misstep can cause a total meltdown. So these kiddos start to lessen. They start to lighten up. They start to physically relax, like where they're like tense and you hold them and they arch. Now they're actually starting to feel a little, their shoulders come down, their bodies relax a little bit. But they also, the only emotions they know are big emotions. So then they start to unwind that. And now they start to have smaller emotions, quieter emotions, less meltdowns. And that's one of the things we see. A lot of parents will tell us, we still have meltdowns, but they're less frequent and they're less intense.
We have a couple of kiddos that have started in our care in the last, I would say 6 months, that their first few visits were very stressful for them, stressful for us because we're trying to figure out what's the best way to work with that child. But coming in, it's like, immediately when they walk in, the door is just like, they're there, they're loud, they're here, they're getting into things. Like there's no sense of other people being around them.
No.
But the cool thing is over the last 6 months of working with these children, they come in, there's a routine, they know what to do. And that doesn't mean that every appointment is the best, but their adjustments are focusing on them being more calm, on them being focused. And so what they're tending to do is those adjustments are then impacting their environments outside. We had a kiddo that did an exam last night, and one of the things that his mom was talking about is that he's more focused, and he still has his outbursts, but they're not completely meltdowns, and they're not ruining the day or the evening, or he's not getting a lot of feedback from his teachers. And so those are really, really awesome things.
Another interesting thing I think about Raging Bull is parents will tell us like, oh, my kid's not gaining weight because they're not eating, because they can't even focus long enough to eat. So their gut's so affected. It might hurt them to eat. Sometimes they just don't feel good. So they'll take 2 or 3 bites. I'm full.
Or they're on another thought and then they go. So like finger foods for them are going to be the best thing, just to keep them.
Grab and go. So, we're looking at a lot of different things because they're not telling us, oh, my back hurts, oh, my neck hurts. That's not what's happening. They're usually not in pain, but we're looking at behavior. So definitely looking at the behavior patterns and the habits they've created, because we said this early on, the body runs on autopilot. Your brain is hardwired to make as many things automatic as possible, because if we had to use all of our brain power, we'd be so exhausted by the time we opened our eyes in the morning. You wouldn't have enough energy to get out of bed.
And we also mentioned that the nerves that fire together wire together. So when you see that, you're seeing these different patterns. And so the third category would be the combination of the raging and the drunken bull. And so what you would see is there's the combination of the both.
Yeah. And that's like truly the perfect storm. And these are kids that end up getting put on medication. They end up getting labeled. They end up, mom and dad are so frustrated that by the time they get to us, they are at their wits' end. And they're so over getting contraindicating information, they just don't know what to do.
Well, even coming into our office, they're like, what, an adjustment is going to help with this? And we're like, yes.
Yeah.
But everybody also wants that one quick fix. And it takes time for people to get there. It's going to take time to unwind, typically not as long as it took to get to that initial issue to begin with. So if you're looking for action steps that you can do for your family, the first thing is to keep asking questions, keep seeking hope, keep asking for help. I was at a point where I felt like I had no other options. And unfortunately, chiropractic was my last alternative before seeking some of the other things. But if you're stuck at a point where you have lost hope or you're looking for other alternatives before doing some of these other things, contact our office. You can schedule an exam, you can schedule consults, you can schedule scans. If your child's old enough and there's a need to take x-rays, we have x-rays here on site. If you're interested in how your body's performing, how it's functioning, or you're just curious, let us know. We're here for you. The first step is to schedule that exam, that consult, and then we can schedule the report of findings. And so what I'll do is in the link, I will include a way for you to schedule, so that way you can figure out what's going on. And if you're not in Ormond Beach, or you are seeking another office in a different state or different city, reach out to us. We have a great network of doctors through the PX community that has doctors that are trained the way that we're trained to help manage families' overall health and wellness. So our office process is it's a clinical process. And so the first appointment, we take a deep dive into your history. We want to listen. We want to hear what's going on in your child's health history, or its case history, or even your health and history. The second step would be to do the insight scans to get that baseline understanding of how your nervous system is functioning. And then the third step is to go through the report of findings and get a clinical or a care plan to get an idea of how long it's going to take, and what it's going to take to get your body recharged and healing better. So the first question that everybody asks is, how long does it take? And I wish I had, an answer for every person. It depends on what got you here to begin with. And so the brain has the ability to adapt and to change. The older a child is, the more stress that they've experienced, or the adult, the more that they've experienced. And so the more care that it takes. And so healing takes time. Each case varies, but while we want a timeline for healing, the body heals at its own pace. I've had patients that have come in as an adult wanting to fix and correct one thing, and then what we see is their body ultimately decides what it wants to heal and repair first. And so, I don't know how long it's going to take. It depends on how your body prioritizes that healing process. The second question that we get is, how will you ever take care of a child that is a spectrum kid? How do you get them to sit still? Well, first of all, we don't. We work within that child's needs to help them function. And so we're here. We are always ready for them. And so we make adjustments wherever we need to. That might be on the chiropractic table. That might be in the play area. That might be kind of walking with them and working with them. And so it's hard to describe what an adjustment looks like in a kid that can't talk, but I can tell you what it doesn't look like. It doesn't look like all of these posy things that I have pictures of. It's me working within that child's limitations and that child's ability to get them the adjustment that they need.
And y'all, it does not look like those videos that you keep sending us on TikTok. Not once ever have we thrown anybody out of a helicopter.
We haven't? No, kidding.
We have not, because we don't have a helicopter.
No.
Not saying we wouldn't, but just saying that it's So like, I've literally held a baby while she adjusted the baby. Like, it's amazing. I've watched her do it on the floor, on the table, in a chair. Again, even with the scans, we meet the kids where they are, but we need to create that know, like, and trust factor. Because if they don't know who we are and they don't like us, they're not going to trust us. Right. And it took some time. Some of these kids have been here a lot, and some of them took a little longer to feel comfortable. But now most of the kids that are under care, they know exactly what to do. They're telling mom and dad what to do.
Stop talking, get adjusted.
Get on the table. And then eventually they start adjusting the babies.
Correct.
Themselves. So we are creating future chiropractors.
Yes. Guys, we love being able to help your families. We love being able to serve this community. And so if you have questions, reach out to us. If you are interested in scheduling an appointment, contact our office. Our phone number is 386-236-8085. You can find us on social media at New Journey Chiro. We're on Facebook and Instagram. You can also find our YouTube video, or our YouTube channel. It's also New Journey Chiropractic. We're here for you. Write us an email, info@newjourneychiropractic.com. What do I miss? Send us a text message at the same phone number, 386-236-8085. We would love to help you and your family understand what chiropractic is and explore what we can do to help. So if you have any questions, reach out to us. We love you guys. We hope you enjoyed this, hour and a half of talking. Hope you learned something, and we hope that you're ready to apply it to your life today.
Yes. So, thank you so much. And let us know what we can help you with.
Bye, guys.
Bye.